everyone, and welcome to another edition of Ladies Corner. This afternoon, what an afternoon as well. We have MLA Rakhi Pancholi. She's the MLA for Edmonton-Whitemud. She serves as the official opposition critic for Children's Services, and she's a member of the Public Accounts Committee and Standing Committee for Families and Communities. That is a mouthful. MLA Pancholi, thank you so very much for taking the time.
T, thank you so much. As you know, we've talked about this is a pleasure for me because my very first interview that I ever did when I was running for office back in 2019, I'd never done media before, but my first interview was with you, with Ladies Corner. So I'm thrilled to complete the circle and do it again this many years later.
That is true. I remember that was maybe my first or second, but we were both rookies. And now I'm still a rookie, and there you are. You are the official opposition critic, and you're making waves, getting awards for the work you do. So this is delightful. It is. So we met in 2019. From 2019 to right now, what has it been like for you?
Yeah. It's sort of remarkable for me that it's even been 4 years. On the one hand, it feels like I just became an MLA. And on the other hand, it feels like I've done this job for quite some time. You know, it's been a remarkable 4 years for all Albertans, right? We've gone through the pandemic, which nobody could have anticipated. And for myself, I'm a parent of kids. Now they're 7 and 9. They were 3 and 5 when I first ran for office 4 years ago. And so, you know, during those periods of time and in the pandemic, I was like every other parent and really focused on making sure that my kids were safe and that they were healthy and that they were able to get to school and to participate online when they had to. And so, you know, many ways I was just like every other Albertan, just a parent getting through. But certainly I have learned a lot. I think back fondly on my early days as an MLA and how much I didn't know and how much I was still figuring out. You know, what you also learn through this sort of period of time is it's, you know, a very steep learning curve. There's a lot of things that come at you as an elected official, and then you face unprecedented circumstances like the pandemic. So you have to really find your own way a little bit and really listen to the people that you serve, your constituents, and take their cue in terms of what they need from you. And I think what I heard firsthand from my constituents is they just wanted me to be present. They wanted me to be listening. They wanted me to be reasonable. And so I've really tried to focus on that, being connected with people as much as I can, going to community events, getting to know the community organizations, being present in the schools, and really genuinely connecting with them as human beings, because that's what we all want essentially is to connect as human beings, and taking the stories I hear and what people have shared with me, both in their lived experience, but also their expertise. You know, I spend a lot of time listening to people who are part of organizations or businesses, and they tell me about what they're doing and their challenges. So I'm learning and I'm listening, and then I take that to my work in the legislature. So it has been a steep learning curve, but I've really found that if I trust my instincts and I listen to the people I serve, that you can find your way with honesty and integrity. And it's been very fulfilling the last 4 years.
I can imagine. Thank you so much for that. You talked about connecting to people as human beings. I remember we had maybe once a government that was accused of not listening. So I'm just curious right now, when you go door knocking, what are people saying now to you? Is it the same as what they said in 2019, or it's gone different?
Yeah, it's a great question, Tia. I would say, so I've never stopped door knocking. Even when after the election in 2019, I continued to door knock whenever it was safe to do so, of course, because with the pandemic, I didn't do it as much during those times. But, you know, it really has changed what people are saying on the doors. You know, when I talk to people now, I think, you know, the pandemic really laid bare some things that are really essential, and people have seen that being challenged. And perhaps the number one thing that people talk about now to me is healthcare, and their concerns around accessing healthcare. And that wasn't something I heard about as much in 2019, but certainly because of the pandemic and delayed access to treatment and supports and surgeries. And we've seen a huge strain on our healthcare workers. We know that we've lost a lot of nurses and doctors. So that's probably something that I hear about the most. And it's something that it doesn't matter how old or who the person I'm talking to is, everybody is concerned about healthcare, because if you're a parent, you're worried about, your children. What happens if something, they get sick or they get hurt? I also have an elderly parent who's in, with the healthcare system right now, and I worry about myself. And if you have access to a family doctor, you feel lucky, which I do. But because as so many Albertans don't. So there is a fear about the basic services that we rely on not quite being there the way that people expect and feel secure about. And I think that's true for education as well. So I think those concerns are quite different. People are they're really worried about trusting the people in government, and they want to know that the people who are making decisions have their best interests at heart and are really focused on the same things that they are. I think they get worried when they see, the current government talking about a lot of things that don't really impact their day-to-day lives. They're concerned about healthcare, affordability, making sure they can pay their bills, and that their kids are going to stay here and get a great education and a great job in the future. That's what they're worried about. And that's what I hear people talking about a lot.
Okay, I hear you, and we're going to come to healthcare and education down the line. But since you mentioned it, what would Alberta NDP do differently from what the provincial government is currently doing in terms of education and especially in terms of healthcare?
Yeah. So on education, let me begin by saying the most basic thing, something that we did when we were in government that hasn't been done over the last 4 years, is actually funding every student that's in this province. We have seen a huge increase in the number of students that are in the school system. Not surprising. We have a young population, but the funding for education has not kept up with that at all. We know that population growth and student enrollment growth has not been funded, which is why we see the resources that schools have, which is flat and has been the same for a number of years, being stretched further and further. So you're seeing larger classroom sizes, fewer teachers. We've lost a lot of, EAs, educational assistants in our school system. So we're seeing that strain in our schools. So we have to fund for student enrollment growth. That goes without saying. Let's fund every student in our system. We know that we have to invest in school infrastructure, particularly where I represent, Southwest Edmonton. It's one of the fastest growing parts of the city in the country, actually. And we do not have enough school spaces. We don't have enough infrastructure. So Edmonton Public Schools has not had a new school built announced in over 3 years. So I'm really proud that we have committed that we would build, for example, a new 7 to 12 school in Edgemont, which is just south of the Anthony Henday in the constituency of Edmonton Southwest. That would be a huge relief on the schools that are in my area in Edmonton-Whitemud, because those schools are crowded and pushed to the brim. So we have to invest in schools. We have to fund every student, and we need to make sure that they have a curriculum that actually reflects the world around us, is inclusive and diverse, and prepares our kids for the skills that they'll need to enter the workforce now and in the future. So we have committed that we would be stopping the implementation of the UCP's curriculum, which has been just overwhelmingly rejected by teachers, by experts, by other jurisdictions. So we're going to put a stop to that and make sure that we work with teachers to actually develop a curriculum that will help our kids learn. So that's just on education, T. I mean, in healthcare, the number one challenge we're facing in our healthcare system right now is the challenges to the healthcare workforce. So we have lost a lot of doctors and nurses who have been strained and burnt out and worked beyond belief. And so retaining the workforce that we have, but also attracting more healthcare workers. And we've committed that we will do the biggest healthcare workforce recruitment drive this province has ever seen. We know that we need to make it appealing for people to come from other parts of the country to come work here in healthcare. But we also know that we have so many people who already live in Alberta, who have those skills, who have the expertise, and whose credentials have not been recognized. So we need to make sure that we're looking at that and making sure that we're working with colleges to ensure that we have the experts here. Let's make sure that they can get to work to help use their skills and to support our workforce. And of course, we need to make sure that we have enough primary care. Primary care is probably the most important aspect to support the entire healthcare system, which means that if you need a family doctor, you have one that you can call. And so we are committed to making sure that Albertans can access healthcare when they need it, where they need it, and from the right professionals to provide the right services that they need. So there's a lot of work to do in healthcare. I don't want to oversimplify it because it is quite complex, but it begins by saying we need to make sure that we are strengthening our public healthcare system and working on our healthcare workforce to make sure that it is strong and resilient, and we're attracting and retaining new professionals.
Thank you very much, Emily Pancholi. That was a lot to answer, and I and
I
I
tried my
appreciate.
best. You know, I can talk fast, T.
You did a brilliant job. I see what the problem is, and I was making notes for my write up later on. So you are critic for children's services. As much as I can comprehend what you do, I suppose the question is, what sort of challenges do you encounter um, as critic, looking after the province's children? And would you say under this government, children's welfare has improved or not improved?
Mm. Well, so I will say, as the critic, of course, I don't get to make the policy decisions and choices. I get to put forward ideas and listen to stakeholders and advocate to the government to hope that they'll make some good choices. So, as the critic for children's services, it includes childcare and it includes child intervention systems. So that's, when kids are in the child welfare system. Overall, I like to think of myself as an advocate for kids on all fronts, whether it be in education, healthcare. We've certainly seen some challenges for children's access to healthcare as well. So what I'll say is that, the question of have children fared better or worse, I think that still needs to be told by the data. And we will see some information, I'm sure, coming out in the months and years ahead about how, the measures to see how kids have been doing. We know, of course, the pandemic happened to every parts of the world, every part of the country. So certainly we know kids were challenged because of disruptions in learning. Challenged kids with disabilities really struggle to get the supports they needed in schools. And we're seeing that still being made up for. That's certainly not unique to Alberta, but certainly how this government has responded is really important. Now, one of the issues that I have been a very strong advocate on is access to affordable quality childcare. And affordable childcare is really critically important, not only to make sure that many parents have to work. They can't afford to stay home. And if they're going to go to work, they need to make sure that they have not only a safe place for their kids to go, but a place where they can foster their early learning and get quality early childhood education. So I've been a strong advocate. The NDP brought in the $25 per day childcare program when they were in government. The current UCP abandoned that and canceled that program. But luckily for Albertans, the federal government did come forward with $3.8 billion for childcare. And although the current government, the UCP, was incredibly reluctant to sign on to that deal, Albertans really spoke out loud and clear and said, we need affordable childcare. And so the UCP signed on to that. And I'm really thrilled to see that so many Albertans have seen their childcare fees go down. But there's still quite a lot of work to do to make sure that more families can access childcare because, the UCP is sort of implemented in such a way that it hasn't contributed to the growth of a lot of new spaces. And we really need to focus on early childhood educators and make sure that they're getting compensated properly and that we have enough of them for all the spaces to meet the needs for working families and the kids in this province. In terms of child intervention, it's actually been a really, really devastating time for the most vulnerable children in our communities, who are those kids who are in the care of the government or whose families are accessing supports because there are challenges around meeting the needs of the kids. We have seen record high, unbelievably devastating numbers around the children and youth in the child intervention system who have died over the last 2 years. And those numbers tell a really tragic story about how we are treating and supporting the most vulnerable kids in our communities. We're seeing a lot of young people in particular who are transitioning out of the child intervention system into adulthood who have died of drug poisoning. And this is an issue that I don't believe the current government has taken seriously. They cut supports to this vulnerable group of people during the pandemic. They have not managed to address some huge staffing challenges facing the sector. And in the meantime, we are seeing poorer and poorer outcomes for children in care. So we don't know what the numbers in terms of, child poverty. I was very proud that when the NDP was in government, we reduced child poverty by 50% in Alberta, which is remarkable. We haven't yet seen what the numbers are for this government's record in terms of child poverty, but we do know it's been a really tough time for a lot of families and for a lot of children. And I maintain that if we had just stayed focused on making sure that the most vulnerable kids in our community were served and supported well, we would see that everybody would have been served well. I don't believe that the UCP government has done that. And so certainly when we go forward, we want to work with Indigenous communities in particular. When we talk about children in care, it's mostly Indigenous children, 70%. We need to work with Indigenous communities properly so that they can take responsibility as they see fit for their own children and family, but also make sure they're resourced and supported properly to do that. And we got to focus on the drug poisoning problem, which has really been devastating for young people in this province. Oh, I think you're muted, T. I can't hear you right now.
Ooh,
oh, there
okay.
you are.
Thank you. You said so many things. I'd like to, I've got a couple of follow-up questions just to help me understand your portfolio and your thoughts better. The first question I have, do you feel as though this government is reaching out across the aisle now to work with you? Never mind that weak handshake from the Premier to Prime Minister Justin Trudeau, couples even last week. Do you feel that they're reaching across the aisle? I know as a first one. The second one, you mentioned child poverty. Could you describe for us what that looks like? I know you said you don't know what the numbers is under this government, but as I don't know if you are aware of what it looks like in 2023 and what families perhaps even experience this child poverty thing. Is it Black families or Indigenous families? And then the third follow-up question is about the child intervention system. How chronically linked is it to child poverty, or how chronically linked is it to policies that are not working?
Oh, those are three great questions. So first, in terms of the reaching across the aisle, I will say that this is my first term as an MLA, so I don't have any experience to draw from as like looking at other governments and to know how things were conducted. I have been incredibly disappointed by the approach by the current government. There's not been a willingness to reach across the aisle to work together. It's actually been a lot of childish game playing. You'll recall the former Premier Jason Kenney putting in earplugs in the legislature so his MLAs wouldn't have to listen to the opposition. That kind of set the tone for how the rest of the term was going to be, and it's certainly how it has been. There has not been collaboration. There has not been working together, and it's been very disappointing because I think there are certainly some shared objectives that both parties have, even if we may disagree on the ways to get there. But I think we see a party, the UCP party, has particularly been really focused on like wanting to win the day in terms of arguments and not really thinking longer term about how do we get results and make things happen. And so we see that even in the current Premier, Danielle Smith does not seem to really know how to do anything other than to yell at other levels of government and is not willing to collaborate to actually get results. So yeah, it hasn't been the way I would have liked it to have been. In terms of child poverty, as I said, yeah, we don't have the data yet, but when we're talking about child poverty, we're talking about we're looking at children's, the households in which they live in, and how many are below the poverty line. And your question, T, about is there overrepresentation there of Indigenous and Black families and invisible minority families? And the answer is I don't know that we have that data broken down, but it would seem to be that it would be fair assumption that that's certainly the case when we're talking about children and families who might be engaged in the child welfare system and child intervention, because they're grossly overrepresented. Indigenous people are grossly overrepresented in that system. And these are families who are struggling. And although we shouldn't be apprehending children in this province based on poverty, we know that leads to poverty is intertwined with lack of access to, safe housing. It's related to addiction and mental health challenges. All of those things come together. They're not isolated things. So are there overlaps between overrepresentation of people of color with child poverty? I don't know the data for sure, but of course my instinct would say probably yes. And to that point, we want to know these answers to these questions. We think that's critically important. And one of the things that I'm really proud that our NDP caucus has done is we engaged in months and months of consultation with racialized communities, representing many different ethnicities and backgrounds, to develop our anti-racism proposals and platform. And this is actually something that your viewers and your listeners can view at our website, albertasfuture.ca. It's our anti-racism proposals. And one of the key aspects of that, we looked at how racism and race affects things like economic participation, healthcare, education, relationship to the criminal justice system. We looked at how race can be part of all of those systems that we have. And one of the pieces that we have committed to, and my colleague MLA David Shepherd for Edmonton City Centre has been clear about, and he tried to introduce a private members bill, which was struck down by the government, was that we will bring in anti-racism legislation as one of the key pieces that we do. And part of that legislation will be to require the collection of race-based data. Because one of the things that we know is that we believe there's overrepresentation of persons of color in the criminal justice system, and challenges to access healthcare and education, in child welfare, but we don't always have that data. So we have to begin with the data so that we can show that the systems are not necessarily neutral, and that there isn't a significant impact on certain communities. So race-based data is key to being able to answer the question you asked about, are Indigenous, are Black communities overrepresented in child poverty? My instinct says yes, and there must be some data, but we need government and agencies to be collecting that data so that we can actually develop strategies to address that. Because if we don't have the data, we don't know how to address it properly. So that's pretty key to the work that we're going to do. And then on the last question, T, now I'm going to forget what your third question is. It was about child intervention. Can you remind me what the question was?
Oh, okay. Oh, I need to remind myself. Okay, so let's see. So I think maybe you've answered. He said the question was, is child intervention, is the system linked to child poverty? And you said that there is no data at this time, is what you want to do.
Yeah, and I think, well, I mean, we certainly know that the families who are more likely to be struggling and more likely to need access to supports from child intervention are going to be families that are struggling with poverty. That, I think, it's a pretty clear line, but what we don't know is what the child poverty statistics are yet, and we don't know what the racial breakdown of that information is. But when we look at the overrepresentation of Indigenous people in the child welfare system, we also know that Indigenous peoples are overrepresented in poverty as well. And so, there is absolutely relationships, and it's unfortunate that really our child intervention system, it continues to sort of reinforce, systemic trauma and intergenerational trauma stemming back to residential schools and the 60s scoop in Alberta. And we also know that there's probably, this is actually something I've asked about, is getting a little bit more information about non-Indigenous children in the child intervention system. I'm curious how many of them may be newcomer families who maybe don't understand the structures and have troubles accessing supports when they need it. So again, the ministry doesn't have that information and hasn't provided it to date, but I'm going to continue to push for that. And that's one of the reasons why we think race-based data is important, so we can understand even who those non-Indigenous children in care, who they are and what communities they represent.
We hear Oh, thank you. Thank you, Emily Pancholi. We know that children are our future. And I'm just really curious as to what Alberta NDP solutions are to the death of children and youth from the opioids crisis.
Yeah, this is a very serious issue. And even just recently, some of my colleagues and I were at a committee meeting with the Child and Youth Advocate, which is an independent officer whose job it is to represent children and youth in care and in the criminal justice system. And we were asking questions about this and recommendations for government ministries. And one of the clear recommendations that the Child and Youth Advocate has made repeatedly over the last few years is that Alberta requires a focused, specific strategy around youth and youth opioid use. We know that there are things that are happening around drug poisoning and opioid use that we're talking about in the province, but we really need one specifically geared towards young people. Who have their brain development is very different. They're at a very different developmental stage. And especially if we're talking about vulnerable kids in care, they may not have the same ability to judge risk the same way, or to, avoid taking on dangerous situations. So when we're talking about a drug strategy, it has to be specific to the developmental stage of young people, because we've seen the numbers increased dramatically for young people around opioid use. And when I look at it as the critic for children's services, and I look at the significant increase in the number of children and youth in care who have died over the last 18 months, most of those young people actually died of drug poisoning, whether it was suicide or accidental. But drug poisoning has played a significant role in the deaths of too many young people in our province right now. And so we have been very clear. We support the advocate's recommendation that the government needs to develop a dedicated strategy around opioids for youth. And that means even understanding, do we need to look at our curriculum, for example, and what do we need to be teaching young people, even, as young as is appropriate, to understand the risk related to drugs. And we need to have honest conversations so that kids are aware and learning and are just can really better address and measure the risk associated with taking some of these drugs. We need to make sure that it's part of our, our understanding of all our systems and supports, teachers and social workers and early childhood educators and everybody who's working and engaging with children and families should be aware of how to address these issues and even how to administer naloxone, for example, in case of need. And so there's lots of things that we need to be doing, but it does need to be specific to young people. We can't just assume that the same treatments or strategies for adults are going to work for young people, because while we can try to encourage adults, for example, to seek recovery and go for treatment, we're talking about a 13 or a 14-year-old who may be living in a group home, who is Indigenous, who has experienced trauma, who doesn't have strong connections to their family, has been maybe separated from their culture. How can we expect that young person to opt for treatment and recovery? Well, we need to work with them where they're at. So we definitely need a specific strategy for young people around opioid use.
Okay, thank you, Emily Pancholi. We're nearly at the end of this. I want you to, I'm just wondering if you think it's a fair question to ask what your achievements have been, because in less than 100 days, it is now, we start a new cycle. Is that a fair question, focusing on what you've been able to achieve, even in the opposition?
I actually really appreciate that question, T, because, people ask me all the time if being in opposition, we feel frustrated because we don't get to make the decisions. We don't get to introduce legislation. We don't get to decide how money is going to be spent. And of course, there is a degree of frustration. But I always say that I actually have felt an enormous amount of satisfaction and that I have achieved some things. And, key to that is, I was pretty tirelessly advocating on affordable childcare, even when other people weren't talking about it. I was talking about it quite relentlessly, and I did my homework and I read a lot of materials and I met with tons of stakeholders and educators and associations and parents, and really advocating on that issue for quite some time, quite relentlessly. And although I wasn't the government that got part of the government that got to sign the deal with the federal government for billions of dollars investment in childcare, I do feel like my advocacy on that matter really made a difference. I do feel like it brought the issue to attention of a lot of Alberta parents who then spoke up and used their voices and were persuaded the government to take action. So when that deal was signed, which was in late 2021, I, of course, was not somebody who signed that deal. I was not part of the government, but it did feel like an achievement, and it felt like real progress for Alberta families and our economy, and I was proud to play a role in that. And then I'll say, on my personal satisfaction level, when I was elected in 2019, I don't think I was very well known. And I've worked very hard for people in my community to get to know me. And I feel very gratified when I'm in my community, in my constituency, spending lots of time at the farmers market or in the schools or at community league events, that I feel confident that a lot of my constituents know me. They feel they can approach me and they can trust me. And one of my favorite things is walking through the constituency and having kids walk by and say, "Hi, Rakhi," because I came and spoke to their class or read to their school. And the fact that kids feel like they can approach their elected officials, which I work really hard to try to get them to understand that I work for them and that I represent them, and that they know me and they can trust me and talk to me, feels really like an achievement. And it's the kind of thing that keeps me going, and one of the reasons why I'm running again. This is really important work, and I feel very privileged and honored to have done it for the last 4 years. Oh, you're muted again, T.
Why am I doing this? Anyway, I want to thank you for your answer. I want you to reflect on what Alberta NDP is doing to help children, especially Black and Indigenous children and youth, get into like the STEM education, like science and technology. And I also wanted you to talk about, if given another chance, what direction would you take the children's services, the children and youth to?
Yeah, great questions. So, I think when I talked a little bit about our anti-racism work, we talked a lot about work around our education system and our curriculum. And I'm a big believer, T, that if you want children to believe they can do something, you've got to help them see it. For me, one of the reasons why I ran for office in 2019 was I grew up watching Alberta politics, and I didn't see a lot of people who looked like me around the decision-making tables and in those leadership positions. And that is certainly changing. So certainly we need to highlight and profile and have help children, Indigenous children, Black children, people of all racialized communities see themselves in leadership roles and not just do it as an aspiration, but to show how valuable that input is in things like developing our curriculum, in developing our responses in healthcare to make sure that more families have access. We need those voices. So it begins from a place of inclusion and celebrating those people in those roles, but also highlighting the value that we get out of it. It's not simply about representation on a superficial level. It's about contributing to a discussion and bringing perspectives that have been absent for too long. So a lot of our anti-racism work is focused on those ideals, is making sure that Indigenous children, Black children, people of all ethnic backgrounds and racialized communities see themselves as playing a critical role in policy development going forward, and that we need that for good policy development. The path of reconciliation for all of us who are settlers on this land is that we must work collaboratively, but keep our hearts and our minds open and truly listen and engage and learn. So it's got to be infused not just in specific things like curriculum, but in all the work that we do. When I think about going forward, and if I were to be the Minister of Children's Services, for example, I would want us, this province, to start thinking about how we think about early learning and early intervention as critical parts of our social and economic infrastructure. We know that if we provide supports and services to children when they are young, the right supports where they need it, we don't have to make families fight to get access to it, that it is available, that those young people are going to be more likely to be ready for school, more successful in school, more likely to have fewer health interventions or criminal justice interventions. These are great things. I would like us to see shaping our policies around focusing from children, because if we focus on children and make sure, then we're going to address everything. Then we'll make sure there'll be healthcare available the way families need it and the way children need it. Education, our climate, that we will be taking seriously the challenges to our climate if we don't decarbonize at a good pace that brings people along and engages them along with it. If we focus on kids in the decisions we make, we will inevitably make great decisions that will make it better for all of us who live in this province. And so, that's the direction I think we need to go in all aspects. Focus on kids, and we will serve the entire province well.
I like that very much. Focus on the children, focus on the kids. So do you get time to read recreationally, and do you plan to celebrate Valentine's tonight?
Oh, that's a good question. So actually, it's been part of my mission over the last years to read a little bit more, something that has nothing to do with work. For a long time, I was always reading papers and emails and things just before bed. And now I'm like, no, I'm going back to, I've always loved to read. And so I've actually pretty active at the library. I'm a big supporter of the Edmonton Public Library. So are my kids. So I'm reading a book called Cutting for Stone right now, which is an amazing story about some families in Ethiopia. And I love to learn through fiction. And so I do read recreationally, not as much as I like, but I'm going to keep at it. As for Valentine's Day, well, my husband is a true hero because I work a pretty crazy schedule and pace, and he is a fantastic partner. The reality is, with 2 kids and 2 busy parents, we didn't really remember that we could maybe go out for Valentine's Day until it was too late to get a reservation anywhere. So we're probably not going out for Valentine's Day dinner tonight, but we did take a rain check, and we're going to hope to do it another night. So tonight I'll just celebrate with the kids and eat some of the candy that they got from school, and that'll be Valentine's Day.
Fair enough. MLA Rakhi Pancholi, thank you for the extended time we spent, and thank you for giving clarity to priorities of the Alberta NDP and helping us understand where we are. I think we should let you go now to enjoy the rest of your day. So thank you very much. Did I miss anything? Was there anything else you might have wanted to add I didn't ask?
I just wanted to say, T, thank you for having me. I really appreciate it. It's always a pleasure to chat with you, and I would love to do it again whenever you'd like.
Lovely. Emily Pancholi, enjoy the rest of your day and happy Valentine.
Happy Valentine's Day to you too, T. Take care.
All right, then. Thank you. Bye-bye.
Bye.